Now, why do we fear? Fear takes place when we know that, yes, there is something like existing. For example, the example which I gave over here, let me talk about some other example. We are not prepared for our exams, especially maths, or if I talk about the science subjects. There we start fearing. What would I write in the exam? Right? And because we know that we are not prepared, that is the existing fear. Or existing, it's already existing and we are fearing for that. But what is, I don't know what is after this. Okay. So hopefully what exactly is fear? I hope it's clear. Okay. Now, what is phobia? Now, phobia is also a type of anxiety disorder. I'm going to talk about all the anxiety disorders, but it's excessive fear of something. We have phobia of something, right? Some have claustrophobia, some have fear of some objects, some situations, some animals, water, right? I do have fear of water. Even if I see a small water passing by, I get phobic. So that is what phobia is. And maximum of the time, it has seen that phobia generally originates in childhood. Like there is a triggering thing. For fear, nothing, childhood is not there. For anxiety also, most of the time childhood is there, but most of the time it's not persisting. But for phobia, it's from childhood. And this is what phobia is. You can see the snake which I gave over there. We all have fear of snake. Most of us. I'm not taking about the example of everyone, but most of us fear what exactly, how we are going to encounter if you are seeing a snake beside you. That is what phobia is. It's very unrealistic. I won't say unrealistic, but irrational fear. You can face the situation, you can't face the situation. It's in a doubt of 50-50. But phobia has to have certain triggering factor in childhood. That is phobia. While taking up the case history, you can every time find, or you can take the history of childhood. Kuch hua tha past mein. That is what, if you see, yes, there can be certain causes of phobia. Now I'll come up to anxiety. What exactly anxiety is? Any idea? Ulta pulta definition bhi chalega, not an issue. Anything?
मैम एंजाइटी परसीव्ड थ्रेट के लिए जब ऐसा फियर जिसका कोई जेन्युइन रीजन ना हो.
Yes. It's a worry. Right? It's something we are apprehensive about. हो भी सकता है, नहीं भी हो सकता है. It's always related to future. It's something we are thinking it can occur or it can't occur also. Namrata, we did not cover much, but we only covered what is fear and what is phobia. So I'll cover up in the end of the session what is fear and phobia for you, not an issue. So what do you think? We have anxiety or we have anxiety disorder? Most of us are anxious about something or the other. So we have anxiety or we have anxiety disorder? Anyone? Akriti, you are on mute.
We have anxiety.
Okay, and when it turns to disorder, what is the... I'm not talking about the ICD and DSM criteria, but in general, when we can call it as disorder.
जब ये हमारी क्वालिटी ऑफ लाइफ को डिस्टर्ब करने लगे.
Yes, when it's hampering both our personal and professional life. So anxiety is we are not known. That is an unknown cause. I'm going to give example in the upcoming slides, what exactly happens and how exactly it happens. But as of now, anxiety is we are not clear for what we are worrying or for what we are anxious of. Now, little bit of anxiety is very fruitful for our life. Without anxiety, we can't sustain. For example, after this class, if I tell you all that I'll be giving a case study, for example, and you have to submit the case study by, let's take by 2 p.m. After 2 p.m., if you are submitting, you are not going to get these certificates. So what would you all have? Anxiety, fear, which one?
Anxiety.
Yes. You all can submit, but you are thinking, agar I can't do. That is anxiety. And it's very, I'll talk about the psychodynamic theory, what Freud said in my upcoming slides. So you can know what is actual cause of anxiety as per Freud, Sigmund Freud. So difference between anxiety, fear and phobia clear, or any doubts till now? Okay, I know Namrata won't be on that side of having a clear definition. I'll come up again. Okay, now, as I said, anxiety for each one of us would have different symptoms. If I talk about myself, for me, anxiety is I'll be eating up all my nails. If I talk about Namrata, she'll have issues with her sleep cycle and also issues with her food habits. Eating much of food, eating less of food. Like, kabhi kabar hum log hota hai na ki we are munching so much on food. So see, main symptoms can be it's disturbing your life and you are avoiding your daily activities. For example, after you get up, we generally sit for our workplace or we leave for our workplace. That is being getting disturbed. Second is headache. Yes, it's very common. Headache, nausea, these are the most common symptoms of anxiety. Emotional outburst. Even if your mom is saying, come on, have a dinner with us, you are getting pissed off. You are shouting at your mother. Difficulty in sleeping. Yes, your sleep cycle gets disturbed. Appetite, your food cycle also gets disturbed. Either you are eating too much or you are not even eating. Seeking reassurance. Yes, it's definitely you are going for reapproval of everything. Whether it's right, whether it's wrong. I did it. Achha, let me check. This PPT. Okay, this PPT. You are going for cross-checking for more than 5 to 6 times. You are being occupied with one single thought. What if I'm not being able to submit the assignment by 2 p.m.? What if I'm not being able to submit? That is only occupying your brain. And also you are overthinking. What if? Agar, magar. What if I completed my work by 1:30 p.m. But what if my Wi-Fi is not working? What if my laptop starts draining the battery? What if my phone gets switched off? So these are the constant thoughts which comes to your brain. For this, there are treatments. Symptoms clear? Okay. So I give the full symptoms in a chart format so that it's pretty easier because most of us can retain the more than anything else we can retain the picture, the pictorials which we can remember. At least in my case, if I go by the PPT, I don't remember anything. But if my teachers gives me any sort of picture thing, I'll remain it for more than 5 years or 6 years. So these are the shorter version which I talked about in the previous slides. Now, how many of you all get angry when your friends or your relatives says you are not looking good or teases you? Yes, honest confession. Yeah, I do get. So how do you react? How do we react?
We shout.
Okay, any other response? Even we do also. Yes, Sudha ma'am?
Yeah, we try to ignore them or say you are not looking that great or something.
Yes. 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 So what happens? We try to find out humor in everything, right? So that we are not getting tensed with someone else's behavior. But these generally don't happen. If someone say you are not good in doing this sort of therapy, though we know we are not good at doing that sort of therapy, we not only get angry, we also get anxious. It's not fear right now. It can be, why I said anxious, it can be you are getting more well experienced with that therapy for more than 6 months or 6 years, and then on the 7th year, you are doing more than what that individual did. So it's just an appreciation and nothing else. Sorry, appreciation, I'm saying apprehension. Clear? So this was just a breakup for this. Okay. Now I'm going to talk about the psychoanalytical theory which Freud gave. Now, who was Freud? Who was Freud? Tell me.
Psychology.
Okay, father of psychology. What he said in his theory?
He spoke about, I think, ego.
Okay.
Conscious, subconscious.
Our behavior is controlled by our unconscious mind.
Yes. Anything else? Tell me an example. What example could you all give for ego and superego? Freud gave the example of ego and superego. So what according to you all, what you can give?
I think he gave an example of an iceberg.
Yes.
Not wrong. I remember iceberg.
Yes.
What is
Now
actually what we see is actually the tip of the iceberg, and something which is hidden, subconscious. That's water level, which is actually more. What we see is very less. It's like the tip of the iceberg.
Yes. So do you think actually our mind is like that?
Sorry?
Do you think our mind is actually like an iceberg?
No, probably.
No. Okay. Okay. And anything else? Nothing?
Yeah.
Any other opinion on iceberg or ego, superego? What happened? No, it's perfect. So see, whatever disorders you come across in psychology, for everything Freud gives more than the explanation on other therapies. Like if I talk about other schools of psychology, I find more relating to the Freud. I don't know why. It can be my perspective. I can agree. You all can disagree. But yes, I do relate more of all the disorder in as per Freud. So what exactly Freud said? So let me talk about 3 phases which Freud said. I did not mention in this slide because you can put it down in your notes so that it's pretty easier like me to retain it. Yeah. The first phase which he talked about, the toxic theory. Now what happened in toxic theory? It's about the sexuality, the repressed thoughts. Now, I want an honest answer. We all had male teachers in our school, right? We used to get attracted to our male teachers. I need a boyfriend like him. What if he becomes my boyfriend? But generally, I did not have that thought that what if he becomes my boyfriend? But generally, I got this thought that what if he's going to give me all the maths and physics question papers? Then I would have scored more than 100, even. So there are certain thoughts like this, but which we generally don't bring in our unconscious mind. In our conscious minds, right? So this is one, the toxic theory. Now I'll come how all these theories are related to anxiety. Second theory, which he said about the repressed or repression theory, that is the result of repressing our thoughts. We tend to repress our bad or negative experience, right? The day when someone criticized us, if I tell me what are the incidents on which day you were being criticized by your mom, by your dad, or by your grandmother, it would take a little time. For example, 5 to 10 minutes, but we can recall it. What had happened? We are repressing that, right? We generally do that. I'm not ignoring the fact that I don't do that. I also do that. And the third one, which it say, the signal one, the signal theory. Now, all these theories are related to anxiety as per Freud. Now, how? We all use all sort of defense mechanism, whether mature, whether immature ones. Denial and repressions for anxiety works best, right? I hope you all agree with this. That we are denying the fact for fear, for anxiety, that no, it can't happen. But at the same time, we are also getting the fact it can happen. That's the result. We are getting so much of anxiety or anxious in certain situations. So Freud said that the moment we are on these three stages or these three situations, the toxic one, the repression one, and the signal theory one, we tend to get more anxiety or more anxious. And that's the result. We tend to develop anxiety disorder. I think it's not overlapping in your mind like bouncer ball. For Namrata, I think some confusions is there. Yes, tell me. You are on mute.
You're just come again, no? Like it's like
Okay,
Yeah.
I'll repeat it. See, psychoanalytical theory was being given by Freud
okay.
when he came up with his ego and superego, right? But for anxiety, he gave three theories. First one is the toxic relationship or the toxic. I don't take it as relationship. I say a toxic theory
Yeah.
where he spoke about sexuality. Now let me tell you. Okay, I'll give you example for all this. Sexualities mean, see, though we claim that so-called we are modern, but tell me one thing: if you are feeling like to dress in a way a boy does, would your parents, would the society accept you? Now, there is a difference between sex and gender.
Yeah.
Now, how many of you know the difference between sex and gender?
I think we all
Okay. Okay. What exactly is gender? The way we are born. The label the society gives us by seeing our intimate part. The vagina or the penis. It's clear. That is gender. But what is sex? How we are feeling inside. It can be I'm born like a girl, and at certain times I'm not feeling that I'm liking my upper portion or I'm liking my lower portion. I want to be a boy. That is sex. The moment we hear sex, we are like, oh, sex, you are doing sex. But it's sex and intercourse are different. And this is the thought which Freud said about sexuality. We can't be so open with our sexualities. At times it happens for most of us, or out of 10, 2 people, being a boy, we want to dress like a girl. But I'm not talking about the trans. For trans, they need to go for under like surgeries, the upper surgery, the lower surgery, or even they are not wanting to go for surgery. They have certain dysphoria, body dysphoria. They don't want to see their breast. But I'm talking, what if I want to be a cross-dresser or a king, drag queen? People are not going to accept me. Even if I say they are highly modernized. Why? Right?
Yeah.
Then, second is result of repression, the repression theory. Now, what is happening? Related. If you are not understanding, let me know. I'll give 2,000-3,000 examples. Now, what is happening? Repression theory comes in. Now, the moment you are thinking, I want to be a drag king, For example, which girl we want to be a drag king? Even I don't want. For the sake of performance, not only performance, I want to do a huge makeup like drag kings does. But unfortunately, I don't even know how to wear a kajal, so leave it at that part. But what if I tell my mother I want to be a drag king? Though she being a criminal psychologist, she's going to kill me because she can't handle the fact that her daughter wants to be a king, not a queen. So what is happening? I am repressing my desire of being a king, number one. Or if I take it in this way, I want my partner to be a girl. I am a lesbian, but I can't talk to my parents or talk to my seniors or my extended family, blah, blah, anyone. What exactly is happening? I am repressing my thought. No, Baba, I'm not going to talk. What if my mother beats me? What if she scolds me? Or what if she says me, get out of my house right now? I'm giving you one, get out right now. Now, the third is the signal theory, where we are getting the signal in our brain that due to our toxic theory, we are going in our repression theory, which is giving the signal to our brain that we are getting anxious. It happens. This is the cycle of psychoanalytical theory. Clear?
Yeah, ma'am. Sure.
Okay. Is this clear? And also he came up, Freud came up with 3 types of anxiety. Number 1, realistic anxiety or real anxiety, which is the real one. That, for example, I am pretty good in history, but before the exam I am tend to get anxious. What if I'm not getting any answer common? What if within 2 hours I'm not being able to finish my answer paper? What if I after page 1 and 2 I'm going for a tying of the page of 5 and 6, 3 and 4 I'm not doing? So these are the apprehension which I'm making. So that is the real anxiety. Next, he came up with the neurotic anxiety, which means you are expressing your unconscious desire. Now, what can be your unconscious desire? I wanted to do, for example, if I take my example, it will be more clearer to you all. I wanted to do a photo shoot, but my family was dead against that. No, you are not a model. So for what reason you are going to do a photo shoot? And I wanted to create my portfolio. And I did it. But what exactly happened? I did it when I was in my school, class 12. That time, no income. Only I had to depend on my pocket money. I was having a long desire from class 7 or 8. I don't even remember. The day I saw Aishwarya in the TV, that the day I started having a desire that I don't want to be Miss India, Miss World, but I want to have a proper photo shoot. So I went down. I contacted, because that time I did not have phone, no Facebook, no WhatsApp, nothing. I said to my friends that I want to do, but within my budget. And we got in connected. So I was expressing my unconscious. That was my unconscious. Because I knew that I could not talk to my father, mother, or even my brother. So I had to repress my thought of creating my own portfolio or creating my own photo shoot. But I did it. That is a separate part. But what happened? That is my neurotic anxiety. Expressing your unconscious desire. And third is moral anxiety. Now, moral anxiety means where you are violating your own ethics. Now, if I talk about ethics, definitely most of our parents would expect to behave in a proper way with the seniors or with the elderly couples or elderly people. Now, if they are constantly criticizing you in social situation, in social family gathering, would you be very calm and composed, and would you be smiling? For example, it's not like that. So what generally happens over there? We are violating and we tend to shout, "Are who the hell are you?" In fact, we definitely, most of us would be saying, "Who are you to talk in my way? Who are you to judge me?" Right? That means what we are doing, we are violating our morals or ethics, which are being taught by our mom or by our parents. So these are the 3 types of anxiety as per Freud. I think clear. Is it good? So why I didn't go with this PPT? Because if I would have read it, you could have confused. So this is the way I remembered. 3131. You can write it down. If you want me to write it in the, not in the chat box, in the group, I will be writing it down. Okay, do let me know if you want a shorter version of psychoanalytical theory. I will be typing my notes down. I won't mind.
Yes, ma'am. That would be really helpful and very
Okay.
handy.
Thank you. I'll do it. I won't mind.
Thank you.
Okay. So this is, you can read it. I gave the PPT before the class only so that you all can go through. Because in anxiety, more than theory, I believe in practical classes. Okay. Now, this was my condition. Whenever my mother was left, what I used to do, apart from biting my nails, I used to open my socks. But still, it's not there. I used to open my shoe. I used to open my socks. I used to take up my leg and I used to eat the nails from my finger, like from my leg, like feet nails. That was my level of anxiety. But abhi, if my mother is getting late for even 10 minutes to reach my house or to reach my place, if we are supposed to meet, I'm pretty happy. Yes, I'm pretty happy. Arey, late hona hai to hone do na. But during my childhood, even not in my childhood, even in my graduation days, I was pretty anxious. And though I was not supposed to put up my picture, I had a same picture which my friend clicked like this. I was like, and I used to cry. So this was a little about anxiety, fear, and phobia. Now I'll come to okay. Now I'll come to the anxiety disorders. Okay. So yes. Now, any idea what is anxiety disorder? Any bad idea also would work. Anything, could be bolo.
It's like an extreme worry or fear, or getting really panicking about something, and which actually interferes in your everyday life, and you're physiologically you're disturbed, and which is not normal, which is like interfering in your social behaviors and your everyday life.
Yes.
Which needs a treatment, really.
Definitely.
Yeah.
So I spoke about anxiety. Now, what is anxiety disorder? As you said, you are worrying, but it's definitely like disturbing your both professional and personal life when you are not being able to communicate properly. It's very different. As I said, what is fear? Fear is very normal. We all have fear. What if that what if is fear? But anxiety is something which we are assuming. It can be, it can't be. Now, for example, tell me, the day we get married, proper, like apart from getting engagement or what is that called, registered or something, the signature marriage, the day we get occasional marriage when the sindhus are applied or mangal sutras are being given. So what we have, anxiety or fear or phobia?
It's an anxiety.
Yes. Do you think that anxiety is needed or not?
Yes, it's a natural. It's natural. Right.
Yes. Now, why not fear? Vibhuti was there, Akriti was there. Tell me now, why not fear?
Because it's not an unknown.
Yes. I'll come up to the difference one more time for my next PPTs. So I covered what is anxiety. I'm not going to talk about anxiety and fear because in the first slide I spoke about anxiety and fear. Symptoms I covered. Okay, yes. Now I'm going to talk about the types of anxiety disorder. Now, please be sure, we all have all these disorders, only and only the intensity is different. It's only mild for most of us and little also than mild. But the moment it's moderate or severe, it's alarming for your side. Now, what is anxiety, GAD or generalized anxiety disorder? It's something we are always at the back of, or we are getting worried for all the daily activities from getting up in the morning. I'll tell you an example of my own aunt, so it will be more relatable. She used to get up at 4:30, whether winter, whether summer, all the seasons, and I saw her pretty good. But the day she came, like you call her auntie, but she was being married to her Brahmin. And in their caste, it was, I don't know whether it's true or not, but she said me that in her caste, no 4:30, you can't get up at 4:30. You have to get up at 3:30 and you have to take a bath, go for worshiping, everything. So the moment this changed, it was only 1 hour before she had to get up. But right now, after marriage, she used to get up at 3 only or 3:30. I forgot the exact timing. But she could not put her leg down from her bed. She used to think, what if I can't worship the god? What if my water, like the nalka pani, it's not coming properly? What if I die inside the bathroom? Though she was not having any sort of phobia. Then after that, she used to do all the sort of household work. Before calling to anyone, she used to cross-check. I'm calling my mother. Okay. One ring. And it had happened with me several times that I got missed call for more than 15 times because she was cross-checking that whether she was calling me or not. Though with her name, because my name is Pinky for her, because while I was in my childhood, I was pink, but suddenly I turned black. So she gave my name Pinky and she used to cross-check. And I said her, okay, let's go for a picture. She said me, okay. And she used to see her pallu, the sarika pallu, whether it's pinned properly or not. And she was doing it for half an hour. That time I was not a psychologist. And this was not only with her, and I don't know whether it has to do something with her son or not, but the same thing her son received, my brother received. So see, it's a sort of disorder where the involvement of all the household activities also comes in, because she was not being able to pay a proper attention. And it was very difficult for her because she constantly was sweating, like the sweating on her foreheads. GAD, as the name suggests, generalized anxiety, means you are having a general anxiety for everything, whatever you are doing it. Yes, Namrata.
Yeah. It also involves in a very mild form, not extremely, that every day when we go out, we just keep checking multiple times whether we really locked or switched off the stove or fans and lights, everything.
Yes, that is the thing. Yes, I honestly said that is the thing. See, we all have generalized anxiety. We can't ignore the fact that we don't have. But we don't, like I saw my auntie, she went with me 40 minutes. Like we were walking and we used to go for walking, not every day because I'm not fond of that exercises. But after 40 minutes, she said me, did I lock the room? She took up her auto rickshaw from there and she came back. I was like, what the hell is she doing? That used to hamper her life. And even it had happened with me that my mother was not there. I was in college. I came to know about anxiety, like GAD. I did it only for 2 times. Then my mind was very calm and quiet. Yes, I locked the door because the lock was very different. It was a number lock. So for me, the thing was, it was a number lock, a very new thing to me, and it was quite easy. Though it was quite easy, but I was getting anxious. What if I am not being able to lock and my mother is coming back home and she's screaming on me? So we all have all this sort of anxiety. But generalized anxiety, for them, the intensity is too much. It's a combination of, and also it's on the spectrum of emotional and physical. Emotionally, they are getting so much disturbed. Though they know they did it perfectly, but still she is doing like this. What if I talk about this? My aunt, she used to do biryani very well. But after this, I saw she had thrown more than 7 to 8 bowl of biryani. The big haris, which we call in Bengali. So I asked her why. She said, me, I don't know, but I feel that I did not put this masla. I said, no, you gave the masla. But she she thought that she did not give. It was a general. I also did 1 to 2. The first day I started making tea for my mom and dad. That what if the sugar was bit more, the sugar was bit less. But for her, she did not only for 1 day. She used to do regularly. Whenever she's cooking biryani, she's doing. Whenever she's cooking fish, she's doing. Whenever she's doing, she's going out, she's coming back after 20 minutes or after 10 minutes. And she's checking, okay, windows locked, doors locked. I remember she went for a long trip to Europe. From there, she reached the airport. From her place, airport is not a difference, only 10 to 15 minutes. She came back 4 times. Right now, I'm smiling. I understand how pathetic it was for her. She came back again, and her husband was literally pissed off with her. Not only her husband, her son also. She knew everything, that she locked the door, she switched off the fridge, AC. She gave for rechecking and rechecking. So this is the level of disorder. We don't have disorder. We have generalized anxiety. Like the intensity, as you said, it's quite true for maximum or most of us. Like if I'm going to my clinic, I'll cross-check. Have I taken, my stamps are there, the stamp which I'll give, whether all the colors, black, blue and red pens are there. Okay, whether my pens are working, the last minute check. We generally do the last minute checking. Like I'll be going off for a vacation on Tuesday for Meghalaya. So I am doing a cross-checking, whether I took my medicines, whether I took my inhaler, which is a necessary part. And on Tuesday morning also, I'll be rechecking. So that is a part of rechecking. But for disorder, if I talk about this scenario, if I would have a disorder, I will be rechecking also in my airport. The moment I land up in airport, I'll go for rechecking. The moment I land up in Guwahati airport, I'll go for a rechecking. So that is what generalized anxiety disorder is. Clear? Okay. Next is specific phobia. I know, and yes, specific phobia. I do have a phobia of not of anything but of water. Okay. Specific phobia means you have a specific phobia for a particular objects, and there are more than, I can give you more than a list of 1,000 phobias which I wrote in my hand, like from net, from books, taking from teachers, taking from friends, taking from courses. I piled up a note. I'll be sharing that, though I forgot. So there are more than 1,000 phobias, and honestly, I don't remember a single name. If people ask me, what is the name of this phobia? Yes. What is the name of this phobia? Yes.
When we used to study, we didn't have any, Google or any phones like this, to save everything. Even we used to gather many things like this, from our professors and we used to write it in the diary. Even I have that, like if I can remember few, like there is one phobia, like fear of long words, which is
Yes.
called monstrous phobia. It's like, yeah, it's got 13 letters or something. We
Yeah,
used to call
I wrote in my hand. I wrote about two phobias. I said, Bapre Bap, it's pretty difficult for me not only to remember, but
yeah.
taking the pronunciation is pretty different.
Mm.
Fear of animals, okay. Fear of blood, that is homophobia, I remember, hemophobia. But after that, if people say me, I only know the fear of claustrophobia. After that, people, if someone say me, it's very embarrassing. But honestly, I can't remember. I know there are hell amount of phobias, but it's pretty difficult for not. I don't know. Only for me, is it difficult or for most of us? But I'll tell whenever I'll take a
You're
talk
not
about
alone,
it.
madam. You're not alone.
Yes, it's very embarrassing when people come up, ma'am, what is this phobia? I can't tell that, go and search it. So I have to search it and I'll have to tell. So there are lots phobia, like fear of letter 13. Though my roll number was 13. I have even seen, like I got a term, I forgot. It's a fear of doing toilet. Long toilet, short toilet. There is a phobia. I said, okay. Matlab, it's pretty difficult. So specific phobia is only on a specific object or specific thing. If you talk about me, I have a fear of water. Like even if I'm seeing a nali, I'll get, it's not panic. I don't get any panic for that, but I am phobic for that. So for me, all these sort of water destinations are like my mom and especially my brother. They'll hold me both like this. As a mother and a father will hold a child, and they are going to get me dipped in water. I remember for a trip to Goa and Thailand. It was my most horrible visit, and I said I'm not going to go. So pretty difficult, but I'm going to give the list. You can learn, you can remember, you can retain in your long memory, but my long memory is not working properly since childhood. So not an issue. Specific phobia means when you have a phobia for one particular thing or two particular things like owl and snake, or water and flight, like not flight, height. Or even some have phobia for needles. Some have phobia by seeing bloods of others. So that is what specific phobia is. Next is agoraphobia. Now, agoraphobia is where you are having a fear of open space. And you also know that you can't accept, like it's kept from that path. That is what agoraphobia is. And I have seen my friend, she was having phobia for this and she was having agoraphobia, and she used to avoid going to South City, like malls, because she knew she can't accept. And it's also very certain that the moment you are having agoraphobia, you start thinking of other. For example, if you know that you are supposed to go to a meeting and you can't accept the fact your meeting is on chalo maan lete 14 February with your boss. That is only Black Day, because I celebrate 14 February as Black Day, not as Valentine's Day. But the as the date is coming closer, from 10th February or from 5th February, that individual would have phobia, would not come outside the room. They prefer staying inside their house only. This is the level of agoraphobia. The meeting is on 14th Feb. They'll start having phobia from 5th February, 4th February, or from the month of February itself. Or it can be on that side that the moment the individual is getting an intimation that, yeah, you have to attend this meeting or conference on 14th February, he is having phobia. So this is what phobia, like agoraphobia is. Next is social anxiety disorder. It's very common. Now, social anxiety disorder means where you have issues with talking to other people in a social gathering. It can be due to what if people are rejecting me? What if people are criticizing me? What if people are humiliating me? These are the facts of SAD, which we call as social anxiety disorder, that people, and it's very true that we also do have. Like, I'll tell up my own thing. It was my first paper presentation. Though I was very excited, but at the same time I was very nervous, because the conference that in that conference, most of I know I have seen in TV that time, the therapists, the psychiatrists, the special educators. I did not have a thought. I don't know why it's a specific or not, but I did not have a thought that only counseling psychologists, clinical psychology, rehabilitation psychologists won't be there. What if the doctors, the psychiatrist starts criticizing me? I was having this phobia, I remember. Though it went very good, but while I was holding my like the mic which they gave me from here, I was speaking, but people could understand that for the first 20 or 15 minutes I was like fumbling. I could not even explain whatever I wrote it in the paper. I don't know, but after that it had eradicated. I won't mind right now, but for me, it was only, I thought, what if the psychiatrist does the criticism? The paper is not good. The stat portion is not good. The writings is not good. It can be on that side also, but for me. But for the other individual, it can be, what if all the individual sitting in a room is criticizing me? So this is what, and they have a fear of rejection. And for this type of individual, getting in a relationship is also very difficult. What if my partner is criticizing me? I have a client, not right now. He was very cute and he was a model, and his girlfriend was a model. So he came to me for a therapy session. And he said me, though I had, because that was the very intense case and I had to refer it to a clinical psychologist from my area. Both were in the 27 ages. 27 was the age. And this boy said me that, ma'am, I like my partner. Nothing, I can't ignore the fact. But the moment she says me that let's get romantic or let's get more closure, I tend to get nervous. What if I'm not being able to satisfy her? What if I'm not, after opening my dress, what if she is not liking me? It can be. What if she's not liking my penis? And what if she's not liking the way I am smelling, the natural way, not after applying perfume or something? But what if she's not liking me? I remember these are the 4 things he said me. So, and the girlfriend used to complain, ma'am, he is not touching me. He is not getting intimate with me. And for this reason, our relationship is getting more boring. But it was pretty difficult for me and back during that time, because that was my first session and my first experience also. So because I was not being able to convince the girl that your partner is having anxiety disorder, especially, he needs treatment. They do have issues with this. They can also be in a relationship. But the moment this sort of thinking comes, what if my partner is not liking the way I'm doing sex? He will or she will start judging me. That's the moment they'll back forth. So this is what social anxiety is. Next is panic disorder. Panic disorder is, well, panic. Firstly, you have to understand what is panic attack. Panic attacks last only for 3 to 4 seconds. And when you are getting recurring panic attacks, that turns to panic disorder. Clear with panic attack, then I'll come to panic disorder. Now what happens in panic disorder, and also it can happen on that line, you are getting panic attack and at the same time you are getting panic disorder. Now how? Monday is your exam, right? Please, no exam, but yes, for example, Monday is your exam. from Sunday night, you are getting panic attacks. And in the exam hall, after 1 week, from Sunday, you are getting the panic attacks. What if I'm not? What if panic? And it's only for 3 to 4 seconds, not more than that. But on Monday or on the exam day in the hall, you got a panic disorder. That, and also the duration matters. Not every panic attack turns to be disorder. But yes, if you take a case, if you have seen 10 cases on panic attacks, out of 10 cases, 4 cases can be of panic disorder. So you have to be very clear about the case study which you are taking, the detailed case history which you are taking. Because panic attacks are only for 3 to 4 minutes. Sorry, yes, less, not more than that. But for disorder, it has to be a repetition for that. For panic attacks, you are getting attacks. Then it would turn to disorder. And I don't know whether I gave it over here. No, I'll come to that. Okay. And panic disorder are of 2 types. Or panic attack, you can talk about panic attack or panic disorder about 2 types. Number 1 is unexpected panic attacks or unexpected panic disorder. Second one is expected panic attack or expected panic disorder. Now, what is unexpected? Out of nothing, you are getting a panic attack. Okay? And and expected panic disorder, that means you are having some sort of phobia. For example, most of us are afraid of seeing a snake. The imagination, the virtual imagination of getting a snake gives goosebumps, right? Now, if you are continuously thinking about snake for 1 month, 16 or even 16 days, I was supposed to tell 16 months, not months, 16 days. That can be a panic disorder and expected because you expect it. Clear? Okay. Next is selective mutism. Now, this is for children. This is not for, it can be for us also, but majorly you can get children, teens. They don't speak up in some social situations. Now, let me tell you one own story you can understand. I did not like my दूर की रिश्तेदार का grandfather, and till now if I think about him I get pissed off. I don't know why. By his face, by his way of talking to others, because he at that time he was a rail officer and his ego was beyond the atmosphere. And till now, even if he see any rail officer, he have a belief that you gave money and you became a rail officer, because that time even 10 rupees was a huge spectrum comparing to right now. And I remember I have a friend who stayed there, and this is for me, and we were in schools. We used to travel to school. And I remember my mother invited him, though I don't like. She knew everything. I was in class 6 or 5. And the moment he was in my house for 5 long days, I was muted. It was not that he said me that don't talk. It was I am muted. I won't be talking to him. Because I did not want him to come. But it was expected that yes, my mother gave an invitation, official invitation, because Tabi invitation was not over phone. It was on the ghar phone, like a dial system phone. And my mother used to write letters. And she gave an invitation for this. So I was muted. And I was so young. It was 5 or 6, not even 6. You can take it in 5, like after final exams. So selective mutism is where you are muting yourself for a particular situation, for a particular individual. Like if I talk about selective mutism, I can tell Bino who is there, Nidhi Singh who is there, they are selective mutism because they are not interacting. Either it can be on a fact that they are not liking the class, they are not liking the topic, or it can be on the fact they are not liking me. So this is what selective mutism is. Now, IAD, which is illness anxiety disorder, is, let me give you the example instead of going by the definition. For example, I am having a pimple over here. And I know my brother belongs from this IAD category, though he won't accept the fact. Now, last to last night, that was Friday night, he said me, Didi, your pimple is not going for a month. And yes, this pimple, I don't know what happened, but this pimple is either getting big or getting small, either getting big or getting small, and it's not going out. Even if I apply the turmeric. So he said me on Friday night, is it cancer? And for a couple of seconds, I got a heart attack like thing. That what? Cancer? No, it's not cancer. So that is IAD. Even if you are having a pimple, they are going to give a name of tumor or cancer. He said me cancer. And this is a very serious. And it need immediate intervention. I said him that go for treatment, consult a psychologist, you don't have to come to me because he's my own brother. And for him, like my father was having a very bad cough and cold. So he went through all the research and paper. The research paper means over Google, especially the Wikipedia. And he said, this is, what is that? Typhoid. That is a disorder. I said, what is typhoid? That is a disorder. Okay. Now, at that day only, my father got a heart x-ray. What exactly is happening? How much is the cough and cold? And in the one lungs, it was full blur. I have the x-ray report with me. And I was not being able to see where are the lungs, where are the two lungs. And I said, my brother, that he is literally having very bad cough and cold. He said me, Didi, it's not cough and cold. I said, what is that then? Because I also literally got hypered. I said, what is that? He said me, it has to be TB. I said, okay. I knew. But I have also seen him, because he don't have any issues apart from piles. Whenever he'll go to a doctor, especially the house physician, he'll tell the doctor, this is not this is not this, and the doctors get confused. And I remember for his own piles, for doing up certain tests, I don't know the name of the test, which the general physician gave, he consulted 7 Apollo clinic for that test. And he did that. And it was simply my wastage of money. I did not send my father to give that. And it was simply my money got wasted. So my brother is on that side. And he is having illness anxiety disorder. Even if he see that there is a pimple, small pimple, he'll come up that it is a tumor, it is a cancer. They don't get satisfied with one report or with one opinion. And I won't say this is very uncommon. This is quite common. But they don't accept the fact that, yes, they are having certain issues. They won't accept the fact. It's pretty difficult to tell them. They'll keep on consulting. I had during my internship, I remember I saw a client with my psychiatrist. He went to more than 40 plus psychiatrists in all the hospitals, leaving the government, because 40 plus government hospital is not there in my Kolkata. Honest thing. She consulted all the top psychiatrists to get a diagnosis that whether it's actually this disorder or not. And that was the day she came to that government hospital, PG hospital, that was 41 prescription. And I was keeping on turning the pages. Okay, this one, all the top-notch psychiatrists. And even she went out for 2 times to Chennai. So this is the level of this disorder. Here, Please don't get confused. You can encounter these types of client in your clinics. Next is treatments. See, if I talk about the treatments, why I don't prefer taking up a case study. If I talk about, as I said yesterday, my treatment can be on a different level. Your treatment can be very oriented to a therapy, right? But yes, what are the treatments you can go? You can go for CBT, structuring their thought, and exposure, especially for phobias. I am having water phobia, and honestly, one of my clinical psychologists, she said me that she went for this exposure therapy, and I fainted. So yes, before starting the exposure therapy, please be very sure, right? Because it can be on my scale that the client is fainting. And though she was quite senior, so nothing of that sort was there. But yes, she could have fallen into legal cases if my parents would have filed a case. Because it's pretty sure the moment you are going for exposure therapy, the extended, so-called extended, will be coming and claiming or putting a case against you as a therapist. So please be sure while you are doing that, go for systematic desensitization. If something, first ask them to visualize. Dheere dheere, it won't happen in one day. They are visualizing, then you are exposing. It won't happen in that. For treating anxiety disorder, it takes couple of sessions. It can be 15 sessions, it can be 20 sessions, or even more. Right now, I don't have that level of phobia for water, but yes, the intensity had been lowered because I did not continue with my therapy. It's particularly my fault. It's not the fault of my therapist. And it was on that thing because I was having a comorbid condition of getting stressed. So psychiatrist medicines was been given to me, not to get too hyper. And it was, I did not had any, as I said, for phobia, some childhood conditions has to be there, traumatic conditions. So for me, I was in a, like, I went with my, not with my parents, but my extended parents to Goa, not Goa, sorry, Puri. And there in the sea beach, something happened. I literally don't know right now because my mom and dad, my uncle, auntie gave me the thing that I was like, some seashore came and I was going back. So it was in my mind, it was in my unconscious mind. Abhi, I don't have a clear chitta about what exactly happened with me, but yes, something happened with me for that which was phobia. And right now my intensity is very less, but yes, it could be on a very lesser spectrum, but I did not continue with my therapy, my fault. But yes, it can get removed if given a good therapy with a level of like going with the right therapist. It's not like that a counselor can give you the therapy. No. For maximum of the clinical disorders, clinical therapists are required. RCI approved clinical therapists. Because what happened, I'll tell you clear. We all have completed our masters. In our masters, we all get a specialization of clinical psychology, family counseling, industrial psychology, marriage counseling. But mine was not that, or something of that. But the moment we are taking clinical psychology as our expertise or as a specialization, after masters, I have seen some therapists claim, I am a clinical psychologist. Ask them their RCI number, they won't be able to provide it. So getting especially the exposure response or the systematic desensitization therapy done, counseling psychologist can't do. Counselors to can't do, counseling psychologists won't be appropriate. Only clinical psychologists are there because in their MPhil training, they go for a very rigorous therapy modes. 365 days plus 365 days. Because I have seen so many therapists working day and night to be a clinical psychologist, and it's very worth of becoming that. But yes, some do have a expertise to be a clinical psychologist, some don't have. But to be a clinical psychologist in India, you have to have MPhil along with that RCI number. People can claim, I am a clinical psychologist. Please ask them for the RCI number, CRR number. Go for verification in the RCI website. Because Abhi, there are so many, I won't say quacks, but malpractices are being going by counselors. I do have my, I won't name, but she completed her graduation in Bengali, master's in Bengali, and she did a PG diploma course in counseling for only 3 months. And he had nameplate and visiting cards. She boldly writes consultant senior clinical psychologist, and she is practicing. So malpractices are going on, but when we are dealing with individual minds, we can't play. Because more than physical thing, mental illnesses are important. Because take it in this way, today if your hand gets broken, still you can walk. But if you are having any sort of disorder, you can't even walk. Even if you are sad for one single week, you can't you can't walk. So while dealing with any sort of mental disorders, either take under supervision of a clinical psychologist who are working in that area, or please refer, because it's better to refer someone. No matter whether you are losing 5 session ka money or 10 session ka money. I generally do. I don't take many disorders. And in my area, honestly, I don't have that much of disorder. In my area, only I'm a counseling psychologist and I have a clinical psychologist in my same hospital. So it's pretty clear with me and her that jo bhi clinical cases aega, you are going to take, please don't refer my name. And it's pretty clear with the hospital staffs also. So better not to play with the mind, because you can give the other therapies like other worksheets, your mindful therapy, relaxation therapy. But again, for certain mindfulness therapies, also clinical psychologists are to be taken into consideration, and it's mandatory. Okay. So complementary therapy, which I was talking and I'll be doing, mindfulness is there, yoga therapy, other sort of, you can go with grounding techniques, you can go with body scanning techniques. And yes, if there are necessity, obviously the meditations has to be given under a psychiatrist. No general physician, no other doctors, only psychiatrists. Because I have again seen general physician are prescribing antidepressant medicine. I was like, okay. But I can't tell because she was quite senior to me. So I usually don't tell. But yes, while practicing, please practice in a very ethical way. If you are seeing that you are not getting client, no worries. Wait for some time. If you want to be a clinical psychologist, go ahead with your clinical training and you can practice. So this and also you can go for mandala arts. As a counseling psychologist, you can go for mandala arts, because that clinical psychologist also can do. But if the clinical psychologist gives you the permission to handle the client only in that area of doing mandalas or the body scanning, you can always go ahead, but not with so many therapies, especially the exposure therapy, because our clinical psychologist is more trained to do the exposure therapy. Because I can talk about exposure therapy, I can't do. Though I can, but matlab, I know how to do, but I won't be doing because I don't have that much of expertise in that area. Even there are so many courses available, but it's only for your knowledge as a therapist. I want to also say as a therapist, as a psychologist, that how you can help. But always referring it to a clinical psychologist, it's on a safer side, not to fall in any clinic like complications or any bad names. So this is a safer way. And natural remedies for this can be given for homeworks to the client is yoga, exercises. You have to tell them that no alcohol, because alcohol gives natural stress, natural anxiety. Smoking, a big no. Caffeine intake, yes. If someone is having anxiety, there can be a comorbid condition or the symptoms also of disturbing sleep patterns. So if the individual is taking coffee, they are also going to get disturbed in that cycle. Like good sleep, you as a counseling psychologist, what you can do, or if a clinical psychologist is there, what you all can do, you can prepare the sleep cycle. Aromatherapy is nothing but the fragrances which he likes. There are so many aroma, like when I go to sleep, I make sure that my room or my pillow is having a small pinch of lavender, because lavender, for me, I don't know, but yes, for me it enhances the sleep. Deep breathing, yes, breathing. Count and breathe. That is, and yes, drinking tea. Certain individual can drink cardamom tea with adrak, the homemade tea. No tea ordering from outside. But yeah, a homemade natural teas are recommended. And these are the natural way. So now I'll talk about now I'll talk about the techniques. So any doubt till now? Okay. So I hope I have given all the PPTs which I'm showing it right now. So this is one of the breathing technique. You along with your clinical psychologist can go ahead and practice upon the client. Now, first the instruction which you have to tell the client is not to worry. He is already under anxiety, or he is very stressed up, or you, not only for anxiety, I'm also talking about stress right now. For both the thing, or for both the issues, you can ask your client. Number one, you have to set the mood. The client is coming. He's almost like in a hurry. Okay. For 5 to 10 minutes, you have to do calming activities. You can start up with any form of art therapy calming techniques. Then the mood has already been set. Because the moment he enters the clinic or your chamber, you can't say, sit down, I'm going to start breathing technique. It can't happen. Because your heartbeat is right now very fast, or the client's heartbeat is very fast. So you have to adjust the heartbeat. Now you can't adjust the heartbeat, so you have to calm him down. So you can go with any sort of art therapy. The mood has already been set. Now you have to ask the client at that particular day when he is with you, what exactly he is feeling. Whether he is feeling anxious, frustrated, stressed, or bored by any sort of word which he heard. So it can be on that scale. He is feeling all these four. It can be on that scale. He's feeling only frustrated. You can work with all the four also. Now, the moment you are getting the answer, what you are telling, you have to give the client a pen and a paper. Paper means a white sheet, the Xerox wala sheets which we get. So you have to give them. And now, what instructions you have to give, I have given in the lower portion, sit or stand, whatever. Basically, when he is with you, you have to make him sit down in the chair, and you have to tell him to close his eyes and focus on your breathing. We can focus. If we want, we can focus. Now, you have to take a stopwatch as a psychologist, and you have to count, or you have to tell the client to start counting. And this focus on breathing can be for 5 to 7 minutes, not more than that, because the other cycles would require time. Now 5 to 7 minutes, or max to max 10 minutes. Now he is getting more calmer and more calmer, because he is focusing on his breathing, on the how he is breathing. And if you want, you have to ask him whether you want a music, what sort of music. If he say no, I don't want any sort of music, because for some clients music can cause a sense of distractions. No music, nothing. But if he want, ask him what are his preferences. Play the music in a very milder position. Now, what exactly happens? You have to take a deep breath for 4 seconds. You can even practice in your home. It is not only for your client, it's also for your benefit. You can do. Start practicing, focus on your breath. Now, generally, what I do, I'll whenever I'm doing with my client, I'll make sure that also I am doing. So I'll hold my stomach in this way. I think it's visible. I'll hold my stomach and I'll focus on my breathing, because breathing idhar se hota hai, from the navel, and I'll mark my navel. My navel is over here, and I'll start breathing. So it has to be for 4 seconds. And you can count as a psychologist. You can't count. It can be one way you are counting with your client, and also it can be a stopwatch. Then you have to instruct the client. The moment he is inhaling, the client has to hold the breath inside for 4 more seconds. Now he's holding. As soon as he's holding, his chest is getting like this because he's holding the breath. Now, you have to ask the client for releasing the breath for 6 seconds. Now, idhar pe, what you have to again instruct, you have to, if you want, you can change the music. Because first, for taking up the thing, one music was there. For holding, same music was there. Now for leaving. Now, when the client will be leaving the breath, you can play different music. You can keep the music intact. It's up to you, and also not up to you, but yes, up to the client. And right now, ho gaya. But you have to repeat all the steps. See, I wrote it for 10 times. You can do it for 10 times. You can do it for 5 times. Because at certain level, when you are walking, in the first instant, you can't tell the client to do it for 10 minutes or for 10 times. All these steps for 10 times. It would be pretty difficult. So please make sure that you are doing all the 3 steps with your client for minimum, for the first session, 5 minutes, 5 times. Hold 5 times. Release 5 times. Again, hold 5 times. This is one way of calming him down. And it can be also for stress. Now, this is the second activity where means the client has to describe his mood. Now, the questions which you have to ask, I have written down the question. You have to ask the client, why does this feeling happens? For example, he's coming with let's talk about a case. He's coming to you for sessions to a counseling psychologist. If it is not a disorder, if it is on the milder spectrum or even on the moderate spectrum, you got up a case that where whenever he or whenever she wants to communicate his feeling or her feeling to the partner, he or she is unable to do, and he is showing up the symptoms of anxiety. Okay, so this is the situation. For example, now you have to ask the client, why do you think this feeling happened? Why you are not being able to communicate? It always happens that we want to say something, but we can't. I'm not talking about communication disorder. But what happened? We are feeling very anxious. What if I say and she leaves me? I have seen my relationship was on that spectrum that I was not being able to communicate clearly. He was not being able to communicate clearly about his relationship with other friend of mine, and so we broke up. So that was the case. So it often happens we want to say something but we can't. So why do you think this happens? And yes, pen and paper have to be given to the client. Now he will be writing it down. No saying nothing. He simply will be writing all the things down. Now the second question, what happened at that moment? For example, if I say, I'm not being able to communicate with my husband or with my boyfriend. So as a therapist or as a psychologist, you are asking to write down why. Why it did not happen that I'm not being able to communicate. what I am not being able to communicate and what is happening. What are the negative things happening? It can happen that I'm not being communicate or I'm not being able to tell about my problem to anyone, and some pros or negative things are happening. Sorry, cons and negative things are happening. So ask the client to write it down. Then ask him, maybe you will be fine. Maybe, oh, so sorry, I wrote it the English spelling wrong. Maybe you will find the unexpected cause of mood. Now, what exactly happened? Ask the client to find out what is the unexpected cause. As in the first slide I said, when he's coming to you, he's coming up with all these queries or any one of these things: anxiety, frustrated, stressed, bored. I'm not being able to talk to my partner. Hence, not only I'm getting anxiety, I'm getting frustrated. And for that reason, I am also getting stressed up. Right? Because I'm not being able to communicate it with my partner. And then you can ask him, now can you figure it out that what is the exact reason why you are not being able to talk to your partner, or what is exactly your mood and why is that mood right now? So the client says yes. The client says no. If the client says yes, it would be pretty easier for you to take the session ahead. And if the client is saying, no, I can't understand, please explain me, then you are going to talk about the feelings. Now, what feeling? I am not being able to communicate. That is my feeling. I'm not being able to communicate. And what is happening? You have to break. Now you have to again break. What is happening? Chalo, I'm not being able to talk in Hindi. What is happening? Maybe your partner is understanding or do understand only Hindi. Now what is happening? You can use Google Transcript for telling your, if it is an intercaste thing. And if he is telling, yes, I can use. So from there, what you are deriving this solution. You can go for Google, because generally it happens that initially we don't understand what he is saying, what we are saying. If it is an intercaste marriage or staying in India, I'm staying in India, I'm having a relationship with any sort of Japanese boy. So it can be. Now you got the mood. Not only you, your client has derived why the mood of the client is bad. Now in this step 3, you have to go for cognitive restructuring. Now, you have to see what are the good things about and what are the bad things about the mood which you derived from the client's writing portion. And again, ask them to write, do you think this can be solved? If it can be solved, you are pretty good to go for and solve. And if you think that you can't solve, then obviously the therapist intervention is highly needed over here to change its thought process. Now it depends on your client, what sort of cases are coming to you. It depends on what sort of solutions, because as a psychologist, as a therapist, we don't give any solutions. It's not our way. We only help him to find the solutions. So it's pretty, and you can take this. You can also take a printout of worksheets. There are pretty worksheets available in Therapist, and though I am going to give more worksheets in the Google Drive and I'm going to send it. So you can go ahead with this. And next, if something is happening, what exactly happened? We are very tense. Let me tell an example of why take a break from social media. The moment we are in a bad mood, we tend to perceive everything bad. People around us are bad. All the situations are bad. So what happened? I have seen people, the moment they are feeling bad or they are feeling pissed off, they open the Facebook timeline and they post something very negative thought about themselves and about the world. So to avoid this, ask them not to post or not to touch their social media, whether WhatsApp status, put anything in WhatsApp status or put anything in Facebook status Go for social media detox. Teach them the way of detoxing, or teach them the way of coming out. That yes, it can be. You are feeling bad for 14 days. Please don't use Facebook or WhatsApp. Because the more they are seeing the happy thing, even if it can be on this side that the husband had a bad fight with the wife. Now, whenever the wife is opening the Facebook, she keeps on scrolling and she's saying, all the happier couples are posting the pictures of with their partners, blah blah blah, and she's again shouting, the husband is shouting. This is a circle, water cycle. So ask the wife not to use social media, because whatever depiction are there in social media, it's not always true. Because when we are in a happy mood, we tend to do the happiest thing in the social media. But when we are in a bad mood, we tend to use the social media in a very negative way. We go on commenting. We go on commenting other pic pages or other social accounts where we don't want. So ask them not to use, or it's better to go for a deactivate or uninstall all the apps, all the social media apps for a couple of days. When you are working with the client, you can understand whether it can be for 1 week, whether it can be for 2 weeks or 1 month. You can clearly understand. And next, you have to make him understand about the circles. What you can control, what you can't control. For example, it is not in my hand that I'm asking Nidhi Singh or Benu is. So I'm asking them to switch on the cameras, but they are not switch on. For example, so what is happening? It is not in my control, right? So if I think, no, they have to switch on. Chalo, they have to switch on. Will they switch on? No. Negative criticism, is in your hand? No. You are right now in 10 a.m. I can be in 7 a.m. So is it in my hand? No, because it differs from country to country, region from region. So you have to teach them the circle of control. What you can teach, what you can't control. What you can control in the inner circle and what you can't control in the outer circle. I'll be giving out example of what my client did in the therapy session. So you can go ahead with this, because it's very necessary to make the client understand to stop worrying on unnecessary things for which he is getting anxiety. No, I'm not talking about anxiety disorder. I'm talking about normal anxiety. And you have to check again. So this was the wrap up so that you all don't forget. So you have to first focus on your breath. You have to next ask to describe what is right now your mood. You have to do cognitive restructuring by reframing your thought process. You have to declutter your social media. You have to take a break from all the social apps and teach about the circle, which is in my control, which is not in my control. And this is just a quote which I took up from it, that take a deep breath is just a bad day, not a bad life. Therapists often do say it's only a bad day for 1 hour, for 2 hours, or for 2 long days, for 48 hours. It can be bad for you, but it's not a bad life. You have to enjoy, and yes, you have to go for other positive psychology techniques. How you can always depends upon the case which is coming, always depends upon the language which you are using, and also it will be depending on how you are using. So this was the first technique. So any doubt till now? Okay, then I'll go with Anibapti. Don't go. Okay. My most favorite cat. Okay, cat. Come on. Yes. Shit. No, I don't need to. Okay. Now, what is cat? Any idea? No, I'm not going to show. Any idea? What do you think about catties? No idea? It's again a relaxation method. You can do this with children's, adolescents, or in fact, a 70 years old client also. But please don't tell that cat, because there are moment you are telling them I'm going to use relaxation or cat method, they are going to like, Tata, I'm not going to come. So cat. So there was a story. Let me narrate you the story. It's a long story. I'm cutting it short. One day, the cat you can see in the board, he or she, I don't know it's a female or male, but the story was the cat was pretty tensed and was in anxiety. Now the cat went to a dog because the dog was his like the cat's partner. And the dog, we assume the dog as a helping hand, because the dog, as the story says, the dog was trained in certain techniques. I won't say what techniques because I also don't know what techniques, but the dog was trained in certain techniques and he did this with the cat. And so from that time, this therapy, we call it as calm the cat. Sorry, I forgot to write the cat. So now, whatever the dog used to say the cat, he used to listen. Now I'll tell why the therapist goes like the dog, because there is a thinking of every individual. Cat is a very small thing and the dog is a very big thing, right? In size and figure in everything. Cat ka 1, 2, 3, 4 colors hi hoga, or max to max 5. But if you talk about the colors of dog, there are so many colors. Pig, I have seen a blue color dog in my area. So here the therapist, being a dog, is more superior. It has been assumed that as a therapist or as a psychologist, we are more superior than our client and we can dominate the client, but it's not on that area. We can't dominate anyone. If also we are thinking in that way. But the story is the dog had trained the cat in certain therapy techniques which you can do with your client. Okay. So you have to ask the client, or if I talk about this cute wala dog, to take a moment, sit down, and the sitting should be like this, normal, like this, okay? And nowhere, no little sound has to be there, and you have to focus. You can focus on an object. It can be an object. This one can be an object. You can also ask him to close his eyes and focus on any god or anything. It can be a karma one, and yes, it has to be a karma one. Next, the moment he is sitting, after calming him down, you have to ask him to read a page. Now, beforehand, you have to make it clear what you want to make him read. It can be a positive affirmations page or card, or it can be anything, but not on a very negative side. And you have to ask the client to read and imagine those things. Like, for example, please don't go for that I am becoming a chief minister or prime minister or president, but in a very logical way, that what the client, because in hand when you are doing this technique, you know the entire story of the client. And you have to make this reader book way in such a way that the client is getting a solution. Your main aim is to make the client calm and composed, and also to get out of the thing which he is doing now, that is anxiety or anxious feeling. Now you have to write it down. The cat, here what is happening, the dog gave a chirkot, a chitti wala thing to the cat, and the cat is reading. So you have to give something to the dog or to the client to make him read. Now, it's not a dance movement therapy, but the moment he or she, whoever the client is, will be reading, ask him to imagine. For example, he is saying that for a very long time, my mother is searching for a groom and I'm not getting married and all my friends are married, right? And this is causing me not only stress. I'm not only talking about stress, anxiety. You can go for stress also. And I'm getting pretty stressed up. And for this, which is in turn leading me to anxiety or anxious feeling that won't I get married? Now, you know this case, I'm not getting married. For example, now you can give a picture out of the picture in the previous one. It can be a picture where my picture is there and I am getting a groom. Or you can write after, because see, we also don't know when we are going to get married. But it can happen that the client come up to the session and say, ma'am, I'm not getting married, and which is leading me to lead my life in a very worst time. Right? It can happen, and I have seen it happens. So if I talk about this only, what you can write a positive affirmations if you are writing things. If you are pasting the picture have to be of the clients and the would be. You also don't know, I also don't know. So it can be some would be picture without face. Now you have to ask the client to imagine that she is getting married. Now how the client will react. Definitely, if someone is not getting married, he will be on a very low spectrum that, yeah, I'm not getting married. All my friends got married. Now you have to ask, get up and try to move all your body parts. It can, and yes, again for music portions, you can ask the client whether I'll switch on a music or not. And you can, again, if no, don't do. It's also only on the version of the client. Now you have to ask the client to move all the body. And please be sure while the client is moving the body posture, it has to be the full body. And you have to focus. Like, let me remove this so that, okay. Like, if the client is moving the hand like this, it has to be so that all the tension, all the stressed up emotion, all the worries gets flowed away. Okay? If he is moving the head, ask him to move. What is happening? He is not only moving his body, exercise is also happening, because there is, I don't know, there is a name, I forgot the name of asana, which have the exercise of this. Right? If he is moving the entire body, ask him to hold and move. So what exactly, and also leg, because I can put up my leg. So you can always ask. And yes, you can do anything with your body. So this is a way of calming your body down. And the moment the client, he, she, anyone is doing, he will get better. What exactly happened? The cat did all these things and the cat is now relaxed. So the moment the client is moving all the body parts, he get relaxed. And now you can go ahead. Yes, obviously the clients have to practice all this therapy, or not only therapy, the movements, so that he gets more well every day. So this is what the cat technique is. And yes, next is the dog asked the cat, whenever you are getting stressed out, don't switch on your mobile, go for declutter or go for cleaning up your house, right? Because it can be on that side that every day we don't get time to clean our house. If I talk about my workspace is piled up with files, my workspace is piled up with all the books. Either way, I'm only getting a shorter space to keep my laptop and my tab. So ask the client to clean the room. And yes, please be sure that, see, when I do this clean up one, I ask the client to send the picture only if he's on the comfort zone. Because we can't be that we are not comfortable of sending the picture to anyone. So ask him, if you are comfortable, you can send me the picture. You can also give a positive affirmation after that when he sends a picture in your mail ID or in your WhatsApp, anything. And you also can't. And you can ask him to write What are the things he is enjoying when he is cleaning the room? What is happening? When I'm cleaning the room, I can see a chick-chack fantastic room in my workplace. Generally don't happen. I don't know why. The moment I'm cleaning, after 1 week, I see, oh, so many pictures are over here. So, but for the client, it can't be on that line. So ask him to write it down and paste it whenever or wherever he can visualize, so that he can understand that, yeah, these are the things which I enjoy, which makes me feel peace. Let me do one or two things. And yes, we all know music. I'm not talking about music therapy because it's a more specialized version. So ask the client, or even you can tell the client to listen to music, not the zigzag ones, but the Buddhist one, the calming music of guitar or any instrumentals. Or if he know to play any sort of music instrument, he can play that. What exactly is happening? It's not only giving him pleasure over here, also pleasure are coming in his mind. Because I have seen whenever I'm very stressed up, I'll switch on Wink and I'll hear any sort of instrumental, that is especially the guitar one. And after 10 minutes, I'm good to go. Again, perform my daily activities. So you can ask him to do like this. And also you can ask him, it's always on that we don't cry. We don't cry. If I talk about boys, being a boy, you are crying. Gosh, what the society is going to think, must. So ask him, yes, it's okay, cry up. If you want to cry, if you want to shout, do. Nothing bad. And even allow in your workspace also. I have allowed few of my clients to shout in my room, and I tell my reception, please don't come inside. Because it's a way of venting out. Ask him to cry. So that, because tears, I wrote it up in the last page, emotional tears release stress and help us relax. Yes, the moment we cry after 10 minutes, though we feel that, yes, our eyes are like pretty bold right now, but yes, we feel lots and lots of relaxed.
But in some, some areas or some, it's a stigma that boys can't cry, and at some point, maybe boys believe also that I can't cry in front of everyone or anyone, right?
See, don't ask him to cry in front of anyone and everyone. Ask him to cry in front of you, and you are not going to judge. Because I have not encountered, I have met with so many male clients. They say I am not supposed to cry in front of a girl, especially in front of girl. And
Yes, exactly.
I say I'm not a girl. Think I'm a boy. And in my hospital, I do have all the facility. So what I do is I have a like costume of a boy, and I wear that. And I say I'm a boy completely right now. Cry in front of me, and I make sure the client is crying, so that he understands how. See, if the client is crying in front of you, he for 10 minutes or 5 minutes, he will understand, I am feeling better right now after crying or after shouting. After shouting also. So as a therapist or as a counseling psychologist, we have to be very much equipped with everything that we can ask the client to cry or shout in front of us, so that we can make him realize, or we can make the client realize, that it's a way which can help you. So do whatever you want. And it helps. So it always depends whether the client is opening up to you, whether you are that much flexible with the client, because most of us are not flexible with sex workers, right? Or with trans clients. In a hospital, if a trans woman is coming dressed up in that way, or for a change, if I talk about hijras, but there is a difference between trans and hijras. Hijra is only their profession. I can be a hijra. I can dress up in a very loud version. I can be a hijra. I can stand in the traffic and I can give a tali and I can earn money. My dad also can be a hijra. I can ask him to dress up like a woman and earn money. Hijra is a profession. Trans is something else. But we always tend to say, "Arey, wo to hijra hai." Even boys are hijras. I have seen so lot of boys, they are standing out and they are hijra. And the moment they say me, "Please, Shraddhanjali, kisko bolna mat." So it's just a profession. And trans are the ones who have issues with their body, who wants to dress up like a girl. Their soul is pretty of a girl. So there is a difference. So many of us, we won't be in that spectrum. I'm not talking because I'm a queer affirmative trained. So if talk about hijra, they are dressed up in a very loud version. They are coming to your hospital. They are entering in your room. Would you be very comfortable? At the first chance, we won't. Even when I was not trained, after I received my training also, I was not comfortable. Because I was having a fear, what was other individual thinking of me? But धीरे धीरे I came in that spectrum that लोग बोलेंगे ही बोलेंगे. So ask him to be very comfortable. Please be on that spectrum that the client feels very comfortable. Yes, maintaining all the ethics boundaries. Because there are clients who after 5 or 6 sessions, if the client is feeling very comfortable with you, they will be coming to you and they will be telling that, "Ma'am, can I have your Facebook link, please?" Now, so we also have to make that professional boundary so that the client don't crosses that. A client also can come up and say, "Ma'am, today you are looking so beautiful." That also can work. "Ma'am, what is the name of your husband? What is the name of your wife?" That is not to be entertained. We always have to maintain a boundary with our client. So that is to be maintained. And yes, ask the client to cry in front of you, shout in front of you, scribble in front of you. Go for any sort of art therapy technique. Scribbling. If I am angry with anyone, if I'm not getting the picture, I'll write the individual name and I'll go with scribbling. Bus. After 10 minutes, I see whether my paper is there or not. Because mera pura paper, it's like out. So much I need to pent out. Because what happens, if I talk about a therapist perspective, we are always on a verge, we can't go for a therapy. That is a myth. The therapist can't go to a therapy. We also need to go for a therapy. We are listening to more than 7 stories in a day or 5 stories in a day. So how we can walk? We also need vent out. It's not always that we can vent out in front of our parents. We need someone, external help. So that external help is a therapist. So even if the therapist is not available, we know all the techniques, but thoda technique we can apply within ourselves, even if we are not a psychologist. So we should be that flexible, but not that flexible. There is a difference between being that flexible and being that flexible. So that the client don't cross. Ma'am, when you are going to get married, bas. Ho gaya. Pura bigar gaya. So we have to keep that dignity so that the client don't ask all these questions. But at the same time, we have to be very flexible. Now is sleeping. The client is sleeping. So yes, sleep patterns has to be ensured that it's 8 hours of sleep every day. Before going to sleep, ask the client not to use any sort of social medias because the ray of the light, the ray of any gadget, particularly, it's very harmful and it disturbs the sleep pattern. So before going to sleep, before 1 hour, no phone, no laptop, no tablet, no TV, nothing. And you have to be very sure that the client is sleeping or not. Ask him to track. There are so many apps right now. Ask him to do. Ask him to go for journaling. Ask him to write down whatever things, not in journaling, but ask him to write down how many hours he's sleeping on Monday, Tuesday, Wednesday. Ask him to bring that diary to you after 14 days, after 2 weeks, whenever he's coming to you for a session. You can do like that. See, therapy can be customized. Counseling sheets can be customized. And then it's a good to go, la 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 la, that the client will feel better. So many tense faces I can see. Okay. So, any doubt? So, this was it I have given. You can ask the client to go for mandalas. Mandala is very well. In fact, I brought a book on mandala. I do mandala, not every day, not every week, but every month, one for 10 minutes. Yeah, you can go like that. So, okay. So, I have given all the things in beforehand. I'll be giving the names of phobias also. But yes, if you all understand my handwriting, because it's not in Canva, it's not a PPT made. It's my Chidkur wala handwriting, which I used to make during my colleges, masters. Whenever I used to see anyone telling about phobia, I say, tell the name and tell the spelling. Let me jot it down. So this way I used to do my notes. Right now I miss my notes a lot. Because abhi to pura it's in Canva or PowerPoints. So yes. So okay. So any doubt till now?
No, ma'am.
Okay. I don't know. Did he? We know. Okay.
Ma'am,
So
ma'am, can you tell some techniques about specifically for OCDs?
see, for OCD, a therapeutic intervention by a clinical psychologist is mandatory. Without the intervention of clinical psychologist, see, firstly, you have to understand the types of OCD, exactly what exactly he is having. For example, there
should I give example?
Yes.
A relative of my colleague takes bath for hours and hours. और हमने उनको साइकियाट्रिस्ट के पास भेजा and she is taking medicines. But still she needs की कुछ काउंसलिंग होनी चाहिए. In fact, साइकियाट्रिस्ट ने हमसे बोला.
इन लोग का काउंसलिंग नहीं होता है. इन लोग का थेरेपी. काउंसलिंग क्या होता है? लेट मी बी वेरी ऑनेस्ट. काउंसलिंग शॉर्ट टर्म के लिए है. थेरेपी कस्टमाइज्ड है. जो थेरेपी देते हैं वो लोग क्लिनिकल साइकोलॉजिस्ट ही होते हैं. हम लोग बोलते हैं कि हम लोग भी थेरेपी दे रहे हैं. We are also giving therapy. But honestly, this is not therapy. This is not therapy. Therapy more vast, more intense hote hai. OCD, that is the thing I said. For dealing with OCD, schizophrenia, kleptomania, trichotillomania, any sort of sexual issues, personality disorder, anxiety disorder, OCD, any sort of other disorders, if I take, all need to be taken into consideration with a clinical psychologist. Sachi is there. Sachi will be more well equipped with OCD. Sachi, are you there? Sachi, Sachi, am I audible? Okay, I think she is not audible. You can definitely ask Sachi because she is a clinical psychologist for OCD. You can also go for exposure therapies with OCD, not exposure therapy, with CBT only, cognitive restructuring, but that has to be under a very experienced clinical psychologist because there is a term that rehabilitation therapists also can deal with OCD, but no. Clinical psychologists are more trained than rehabilitation psychologists to deal with any clinical disorders. They can only deal with rehabilitation portions. But with OCD, sexual disorder, sexual assault, counseling psychologists won't be able to help. So that is more trained, like clinical ones are the more trained because they go for a very rigorous training. I ran back. I was not being able to do with them. So they do have, and you can definitely ask, but CBT works wonder. Ask him to pen down what are the emotions, why he want. There are certain urges. If I'm taking bath for hours and hours, that means I'm feeling something. Without that, I'm not doing. So ask him to pen it down. Go with expressive. If my knowledge goes, you can go with expressive art therapy. And CBT works wonder with OCT. And also Sachi can help you with this more better.
Okay, thank you, ma'am.
Thank you. Okay, so any other
Ma'am, ma'am, can you give us some tips about selective mutation in kids?
a
How to go about it?
selective mutism? See, in that case, which if I talk about selective mutism where the clients don't want to talk, but social trainings have to be given, because if I talk about myself, nothing works. But for selective mutism, social training asks them to gel well with that. It Sachi is there. Akriti, you can have a word with Sachi. You can gel well with the basically social training. Ask him what is that which is bothering him.
Okay.
Okay. Yes, Akriti, you can ask Sachi.
Ma'am, some tips for hello, ma'am. Some tips for OCD patients.
OCD patients. So I feel like a lot of times when there is OCD, a few techniques that work the best. So obsessive compulsive disorder. There are obsessions. These are basically persistent, intrusive, uncontrollable thoughts. What is our relationship with these thoughts? We take it. I mean, people who have OCD, they take these thoughts very seriously. Matlab, I'll tell you, Api, very right now only, the table in front of me needs to be cleaned. It is not so clean. Abhi cleaning chal raha hai ghar mein, and Sundays generally late ho jata hai. But for someone like me, I know the table is not clean. I'm not taking that thought very seriously. ठीक है, because ठीक है ना, मतलब that is my relationship with that thought. It's a very casual, okay relationship. I don't take it as seriously. Whereas somebody with OCD will take it so seriously that they might end up canceling the session. They might end up canceling on their appointments, their commitments, and they'll be like, no, I first have to go and clean that table, because that thought is creating so much anxiety in the person that in order to get rid of that anxiety, they will try to first clean the table, bar cleaning. And these thoughts are not just related to cleanliness, they can be related to checking, they can be related to aggression, sexual activities, anything. So सबसे पहला तरीका तो यही है, changing the relationship with the thought, और उसके लिए the technique we use is mindfulness. That is, we tell the client that this is just a thought. उस thought को किसी paper पे लिखो. You can tear the paper, flush it, or you can imagine that there's a leaf and you write that thought on a leaf and imagine that you're floating it down the stream. Or you can just remind yourself that this is just a thought. This is like I have to treat it like people passing by on the road. कि हाँ, मतलब जैसे लोगों को हम सड़क पे देख के हर किसी को इम्पोर्टेंस नहीं देते हैं ना, so we don't give it so much importance. So how mindfulness basically addresses three things. एक तो thought significance. ये thought significance को कम करना है, उतना significance देना ही नहीं है जितना हम देते हैं. Second, inflated sense of responsibility. The responsibility we end up taking for each thought. You have to clean the table, I have to make this happen. Third is thought action fusion, cognitive fusion कहते हैं उसको, that we end up thinking that our thoughts are the ultimate reality. And as a therapist, we need to address these 3 points. But number one, you don't have to give it so much significance. Number two, you don't have to fuse it with reality. None of these thoughts are actually reality. And number three, you don't have to take so much responsibility for it also, which brings me to the second intervention, which is cognitive behavior therapy. अब हमने इन thoughts को कम importance तो दे दिया, but how we have to also challenge this thought. Like, what's the worst that can happen if the table is unclean? And then some people will say maybe that I am not a good homemaker, maybe then I am not a responsible person. Then you have to challenge that do you really think that evidence, as per the evidence, are you a bad homemaker? Are you an irresponsible person? And then if you ask me, no, because just now I got done with the therapy session that was held. That is why I was not available for the session here. So technically, ऐसा नहीं है that I'm not responsible. I am taking responsibility. Maybe वो table clean नहीं है, understandable, but I am still someone who is still रिस्पॉन्सिबल फॉर अदर थिंग्स. तो आपको ऐसे तरीके से क्लाइंट को चैलेंज करना है कि जो उनका थॉट है, एवरी थॉट हैज अ मीनिंग. द टेबल इज अनक्लीन इज नॉट जस्ट अ थिंग, लाइक इट्स जस्ट नॉट अ थॉट. एवरी क्लाइंट गिव्स इट अ मीनिंग. वो मीनिंग क्या दे रही हूँ मैं? आई एम नॉट अ रिस्पॉन्सिबल पर्सन. अगर ये टेबल क्लीन नहीं है तो मतलब मैं रिस्पॉन्सिबल हूँ. आपको उस मीनिंग को चैलेंज करना है सीबीटी के थ्रू कि ये मीनिंग सही नहीं है. एंड थर्ड, वी डू अ वेरी गुड एंड एन इंटरवेंशन टेक्निक फॉर कंपल्शंस, व्हिच इज एक्सपोजर एंड रिस्पॉन्स प्रिवेंशन, which is ERP. we make a hierarchy with the client based from graduating from easy to difficult situations, that is the least anxiety provoking to the most anxiety provoking situation. जैसे table clean नहीं है is like the least anxiety provoking, but the room being unclean is the most anxiety provoking, or the entire house being like वो तो फिर like that is number 10. So we make a hierarchy from the most least and to the most anxiety provoking. Then we expose to these triggers to the client. उसके बाद client का क्या मन करेगा, उसको anxiety होगा when he is exposed, he will want to clean it, he will want to do something about it. तो हम क्या करेंगे, we will try to tell him कि आप clean नहीं करोगे, you will not clean the table. You keep exposing the client to the table, but you will ask the client to prevent his response. तो उसके बाद क्या होगा, naturally what happens is anxiety reduces on its own. गुस्सा आता है तो वो खुद ठंडा हो जाता है. When we are laughing also goes down after a while. When we are crying also ends. That is the nature of every emotion. Emotions generally fade out हो जाते हैं खुद ही. तो एंजाइटी भी खुद ही फेड आउट हो जाएगी, वो भी एक इमोशन ही है. तो वी से कि आप टेबल को देखते रहो, बट यू डोंट क्लीन द टेबल, यू जस्ट डोंट डू द कंपल्शन. So eventually the client realizes that the compulsion that they were depending on for so long are no longer needed. Anxiety khud hi kam ho jayegi. So that is what exposure and response prevention. These are the three major techniques we use for OCD: mindfulness, CBT, and ERP.
Thank you, ma'am.
Welcome. All right. But Shradhanjali, you have something to share? Anything else?
No. I don't have anything to share.
Okay. But thank you so much.
Thank you.
Thank you so much, Shradhanjali, for holding this amazing 2 webinars at healtalks.in. It was a wonderful experience. I wasn't able to attend from the 11 to 12 hour today because I was in a therapy session, and then I joined after I got done. But I was available from 10 to 11, and I was really enjoying the workshop. And I hope everybody else also enjoyed it as much as I did. And thank you so much for such beautiful insights shared, Shradhanjali.
Thank you so much. I hope everyone enjoyed and did something. Feel free to ask anything in the group. Sachi is also there. I am also there. We can answer all your queries.
Absolutely. Right. So stay tuned on the group, everyone. Your certificates, the recordings of the workshop will be shared there. I think Shradhanjali has already shared the study material with you guys. So I'll be sharing the recordings and the certificates during this week. Recording to aapko kal tak mil jayega. And the certificates will be in process. So we will be sharing that also during this coming week only. Right. Thank you, everyone. Take care and have a lovely, lovely Sunday ahead.
Thank you, ma'am. Same to you.
Bye, everyone. See you.
Bye, ma'am. Thank you.
Thank you. Bye.
Bye.